Hello and welcome to the fifth episode in our series on cerebral palsy. In the earlier episodes, we understood the introduction and definition of cerebral palsy, its classification, prevalence, symptoms, causes and diagnosis. The next stage is what are the treatment options for people with cerebral palsy. Come, let us meet our expert.
Treatment options, treatment is actually multidisciplinary in children with cerebral palsy. It's not only for one particular doctor you have to follow. Based on the symptoms, you have to visit that specialist. The normal multidisciplinary team comprises of a pediatrician, pediatric neurologist, it could be an ophthalmologist, it could be a speech and language pathologist, or occupational therapist, physiotherapist, and orthopedician and a gastroenterologist whenever they have a feeding issues. So broadly we can divide into medical management and rehabilitatory management. So the medical management, we can address some of the issues. We cannot completely cure though, but we can address some of the issues like spasticity. We can give medications to reduce the stiffness, and for abnormal twisting postures we can give medicines to reduce the twisting posture, and for seizures we give anti-epileptics or anti-seizure medications. And if there is a issue with the bone density, we also give a calcium supplementation, and for excessive salivation also we give medication to reduce the degree of sialuria. Vision and hearing issues, we have to do a lot of rehabilitation, and for development also we have to do a lot of physiotherapy and occupational therapy to improve their developmental milestones. Physiotherapy actually means reducing the stiffness of the body or the contractures which a child would have developed because of the lack of usage. Occupational therapy means to improve the quality of life, daily life skills, basically like having food by hand or indicating the toilet needs or swallowing. All these things will come under occupational therapy, in which the activities of daily living will be increased. In physiotherapy, there will be like exercises to reduce the stiffness or the abnormal posturing or release the contractures. These are the exercises which comes under physiotherapy. As we all know, it's a non-progressive disease. It's not something which is life-threatening or so, but only thing is they're all disabled and they're dependent on one or the other person depending upon the extent of injury. There is no complete cure for cerebral palsy. We can definitely improve their quality of life by addressing their symptoms and issues and making them inclusive in the society by involving them also in the activities of the society. Inclusivity is the key, and there is no specific cure for cerebral palsy.
This concludes the fifth episode in our series on cerebral palsy. In this episode, we understood from the expert what are the treatment options for cerebral palsy, which are the different kinds of doctors and experts that are required for management and rehabilitation of patients with cerebral palsy, and we also posed the question whether this is a curable disease. We will be back with our next episode. Namaste.